Any other thoughts on this? Yeah.
I just have a general question. Maybe it's silly, but how come so many other countries are benefiting from universal health care when our great nation doesn't have it?
It's a very good question. Why does every other advanced industrialized nation in the world, and some not so advanced, have universal coverage and quite good coverage, and we don't? It's a good question that every American ought to ponder, it seems to me. It looked as if we were on our way to that in the late 60s and early 70s. In fact, if you read the Nixon message, what he essentially says is, look, we passed Medicare and Medicaid in 1965. We already require employers to provide unemployment compensation, workers' comp, and those kinds of things. It's now time to finish the job. This was 1971. That was Nixon. And we all thought it was just a matter of, what, a year or two or three, and it would happen. Then Watergate hit, the Nixon plan of the Nixon administration disappeared, and the next guy to come along was Bill Clinton. And we all know what happened to Clinton. Now, it's easy to kind of Monday morning quarterback the Clinton plan. Part of the problem was much too complicated. You know, Mario Cuomo used to say, if you can't explain it to your mother, don't send it to the legislature. Kitty objects to that. She says that, and I think, well, Mario's mother was a very smart Italian immigrant woman. She was. But you get the point. I mean, part of the problem with the Clinton plan was long, it was complicated, it had bureaucratic forms and institutions in it that were very difficult for people to understand. You really want to build on what you got. I mean, either you expand Medicare, it seems to me, which works extraordinarily well, with the possible exception of Part D, which is a whole other story, as all of us know. I mean, can you imagine the Congress of the United States passing legislation prohibiting the United States Department of Health and Human Services from doing what the VA has been doing for years, and that is bargaining for the lowest possible cost prescription drugs? I mean, can you believe this? They're prohibited in the law. VA's been doing it under administrations of both parties, saving hundreds of millions of dollars. Part D prohibits that. But with the exception of that, it works exceedingly well. So I can't explain it. All I can tell you is that we've been debating this thing not just since Harry Truman first proposed it. Any of you know when universal health insurance was first seriously debated as an issue in a presidential campaign in this country? Where are the history buffs here? Anybody know? Want to guess? 1912. What happened in the 1912 presidential campaign? Three candidates. Wilson, the incumbent president, William Howard Taft, and Teddy Roosevelt, who had stepped down after, what, a term and two-thirds, or even more, I guess, after McKinley's assassination. Got mad at Taft, came back, ran as the Bull Moose candidate. May well have ensured Wilson's victory, and finished second, by the way. I mean, the incumbent president was third. Teddy Roosevelt was proposing universal health insurance. Here's one for you. In 1916, in the Commonwealth of Massachusetts, the Republican ticket for governor and lieutenant governor proposed universal health insurance. Who were those two men? You get this? You don't take the final. Well, the candidate for governor was a man named Samuel McCall, whose grandson, Tom McCall, was the governor of Oregon. Wonderful guy. Wonderful guy. Liberal Republican, great environmentalist, banned billboards. I mean, McCall was something. His grandfather. And his running mate, advocating universal health insurance in 1916 was Calvin Coolidge. That's the truth. That's the truth. They were progressive Republicans, capital P, capital R. Proposed, huh?
Wasn't he from Vermont?
Yes, he was from Vermont, but he came down to Amherst and he never left. Lived in Northampton. One of Kitty's dad's favorite stories was about Coolidge coming out of a savings bank in Northampton. One of his constituents said, Cal, you putting in or you taking out? He said, neither, I'm filling my fountain pen. That was one of Harry Ellis Dixon's great story. But I'll tell you, it's not only a puzzle, we all ought to ask ourselves, just what kind of a country is this? When we can't insist that all employers, not just Wal-Mart, all employers pay a decent minimum wage and participate in providing comprehensive health insurance. Because you know, in the last analysis, folks, what now happens in the United States is that when these uninsured people go into the emergency room, that cost is passed on either to us as taxpayers or to employers who do insure.
Yeah.
So we have a healthcare system in this country where Massachusetts 70%, nationally 64% of all employers insure. They're not only paying through the nose of their own employees, they're paying for health coverage in the emergency room provided to their competitors' employees who don't insure. Now, why the business community in this country isn't absolutely screaming about this is beyond me. I don't understand it. Even in the debate over the Massachusetts plan, you remember? Business community resisted. The Speaker of the House, to his credit, said, look, I'm not going to support a bill unless non-insuring employers have to contribute something. And so we finally required them to contribute that magnificent sum of $295 per employee. Any of you know what it costs to insure a family in the state today? Comprehensive family coverage?
15 grand. 10, 15 grand.
$12,000, $13,000. So you can, in effect, opt out if you pay $295. I don't get it. I was very fortunate. When I signed that universal health care bill that I signed in 1988, which is essentially the Nixon plan for Massachusetts, I had the support and leadership of a wonderful guy named Nelson Gifford, who I'd never met, who was running the Denison Corporation. Remember them? Out in Framingham, unfortunately acquired by a California company, and they are no more. Nelson Gifford was a Republican. But he understood this cost-shifting thing. And he became, in effect, our missionary in the business community. And was enormously effective. But I don't understand the... now, you know, things are happening. The governor of California has proposed a plan, not unlike the Massachusetts plan, which would require non-insuring employers to pay 4% of payroll. That's still not up where it would be if they had to insure, but that's a good deal more than $295 per employee. But it's always baffled me, folks. I can't understand it myself. I mean, we've been debating this thing since 1912. We've had presidents since 1945 proposing it. We're still sitting here, and it's getting worse and worse and worse. 47 million uninsured people now.